when I first came here, this was a new thing for us, doing replantations of fingers and hands. And it was a much bigger setup and process, but now everybody's become familiar with it. It's almost routine for the staff. And so we've gotten to the point that I don't even go down to the operating room and go over everything. I just tell them that we have a replant coming in, and the team is unbelievable. Everybody gets everything set up, and I don't even say a word anymore. And that's really a testament to the OR staff being willing to learn a new procedure, my physician assistants being unbelievable, and the anesthesiology team just knowing what needs to get done to reattach fingers or hands. We set up the part while the patient is going to sleep, and I prepare the part to be as efficient as possible. And so we clean it, we wash it out, and then I start tagging and identifying the structures. And you can imagine in a hand there is a lot of structures. So, there's multiple tendons, there's multiple blood vessels, there's multiple nerves, there's the bone, there's some ligaments, there's the muscle. So on the back table we tag the parts, washed it out while Ben's and then you can see kind of tendons and nerves that are pulsed off and how it's a stretch injury. And it's again kind of just emphasizing the wide segment of injury. So when we had at the fingers, the blood vessels were crushed from that. See that indentation on the earlier picture, and then just at the level of the hand, we had a wide segment that everything was crushed and avulsed. Here's the X-ray of the part. There's anesthesia. So I've had lots of patients, families that we can arrange things that they can come in. I have no problem. There's nothing to hide. I'm happy to have people see what we're doing, but it was the first time that had a anesthetist taking care of her son with a major trauma.
I've worked in critical care emergency rooms, so I've seen, people die, and I've seen people lose complete limbs. I've seen so many things, and I just, when I talked to the emergency room physician in Grand Island, it was bad that it was his hand. It was really, really bad. But then all I could think of is it's just his hand. It's not, he's alive. It's not his head. It's not his spine. He's not getting paralyzed. And I knew it was going to be a long haul, but that's what I knew. So it was his hand, and I knew Dr. Hartzell was wonderful, and I knew that we had him right here. And they were going to fly him to Omaha, and a lot of times Faith Regional gets patients from Omaha for Dr. Hartzell. So I asked them, can you please just fly him here, just straight here. And then, so I was on call that night, and Chuck had to come in to finish the surgery that I was on, so I met them on the helicopter, and he was just so relaxed. He was not crying, he was not paranoid, he was not shaking, he was a little bit, I think, of a shock, but a little bit, I think that's just him. He's very, very relaxed. And he knew that everyone would take really good care of him. I didn't actually put him to sleep, I just kind of got him in the OR, put the monitors on, and I was fine. I was completely fine because I knew he was alive and I knew that he would be okay.
We have to get things back as close to normal as we can.
Yeah, and I think because of that, it's helped a lot too, with just moving my fingers and stretching them and everything. Just going there every day, and it's a process, and kind of sucks, but you have to get it done, and it's really the only thing I really worry about in my week. I'm not going to school this semester and stuff, so I'm just really hitting the therapy hard.
We won't be able to achieve individual finger flexion, but I'm hoping to achieve composite flexion, all the fingers together flexing into his palm, and hopefully to be able to get close to be able to touch his palm. We're fortunate that the thumb is already off to a great start, and so we'll be able to pinch ultimately pretty well, and pinch is very important to daily life. And you think of holding a pencil to, just picking up a piece of paper.